So treatment for periodontitis can be either surgical or non-surgical. Usually when we're talking about non-surgical, we're talking about the deep cleanings that sometimes some patients have had with their general dentist. Other patients have come into our practice and they've never had a deep cleaning. So if it's warranted, we'll take that non-surgical step and we'll go through a deep cleaning and see how your gum tissues have resolved or your gum disease has resolved after that point. Now, there are some patients that come in that their disease is so far gone that we can't do phase 1 or non-surgical deep cleaning because it's of no use to them. It would be a waste of not only time, but also money. So in that case, we're talking about patients that will need some sort of surgical intervention. And even patients that have had a deep cleaning can at times have to go up to surgical treatment because the deep cleaning alone can't solve everyone's issues. So if you're a surgical patient, we've got different options and different types of surgeries that can happen. The most basic thing I could tell you is that we've got traditional surgery, we've got laser surgery. So we've got those options, and both of them accomplish the same thing, which is reduction of the gum disease and reduction of the deeper pockets, so they're much more manageable, but they both just accomplish this in extremely different ways. The traditional surgery is very well ensconced in your traditional cutting and suturing, and it is very invasive, whereas the laser isn't as invasive. Some patients, laser works perfectly. Some patients, we might have to go to osseous surgery. Some patients, we can do a little bit of laser and avoid doing a whole bunch of osseous. So there's different ways for us to sort of attack this periodontitis, but it's definitely something that needs to be treated. And the longer you wait, the worse off it is, the more significant your treatment's going to have to be in terms of surgical therapy. Having good gum health is so important. We know that gum disease is associated with 57 other systemic conditions. We need to do whatever we can to mitigate the gum disease, decrease that bacterial load so we don't have a bunch of bacteria running around our body causing other problems away from the mouth. It also helps with being able to chew more comfortably, to eat more comfortably. And who doesn't love to eat? Come on, let's be real, right? We all love a good meal. And if your teeth are hurting and they're just sensitive and sore and you can't bite, well, that's no way to live. You want to enjoy food. So that's another reason. But the main reason is we got to get that disease under control so it's not running around and creating problems elsewhere in your body.